A lot of people don't realize just how heavy the toll of trucking can be on someone's mental health. Driving for days at a time, spending long hours alone, sleeping in a cab, and dealing with constant stress on the road. It adds up. And for many drivers, that stress can show up as depression. Research backs this up. A large study of US drivers found that over a quarter, about 27% reported symptoms of depression, and nearly the same number said they often felt lonely. Another study of long-haul drivers in Canada found that 44% had experienced depressive symptoms in the past year. Those are huge numbers compared to the general population. Now, where depression shows up, alcohol often follows. A global review of truck drivers found that about 1 in 5 engaged in binge drinking, and nearly a quarter screened positively for alcohol misuse in clinical tools like audit or gauge. In other words, this isn't just a stereotype. It's been measured in the industry. It's important to say, not every depressed driver drinks, and not every driver who drinks is depressed. But in health research, these two conditions often overlap. And when you put trucking stressors into the mix, irregular hours, constant fatigue, long stretches away from your family, it's not hard to see why alcohol can become a coping mechanism. The problem is, alcohol doesn't solve problems. It doesn't solve stress. It increases fatigue. And in a safety-intensive job like trucking, it can literally put lives at risk. The FCMSA Drug and Alcohol Clearinghouse shows ongoing violations every single month from drivers testing positive for alcohol. It's not abstract. This is happening in our industry today. So the question is, what can drivers do to break the cycle? First, it helps to start small. Practical resets can make a difference. For example, box breathe. Inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and then hold again. This can lower your stress quickly. And you can do it at a truck stop, while you're driving, or just honestly anytime during your day. A simple 5-minute meditation could help, or even a body scan at night to reset your nervous system. Another step is to cut down on isolation. Depression thrives in loneliness. Making a couple of daily interactions and connections, whether it's family, checking in with dispatch, or even joining an online group, can take the edge off of that isolation. If alcohol is creeping into the picture, it's worth checking it with a professional. Quick screenings like audit can help identify risk drinking early, and more advanced tools like PEth testing can even catch unreported use. The key is honesty in catching it before it grows. If you're struggling, you're not alone, and there are resources. There is the SAMHSA National Helpline. Their number is 1-800-662-HELP. It's free and confidential and 24/7. If you ever feel like you're at a breaking point, you can also call 988, the Suicide and Crisis Lifeline. And for drivers under CDO regulations, there are clear return to work policy programs that can help you get treatment and back on the road safely. The bottom line is this: depression and harmful drinking and trucking aren't about weakness or character. They're about an environment that pushes people past their limits. But there are tools, there are resources, and there are communities to help. I'm here to do my part as well. I provide dispatching support that reduces your financial stress, and I share wellness tips and tools and resources. In this video, I have included my 5-minute meditation guide along with the box breathing guide as well. Because when drivers are less stressed, they're much healthier, they're a lot safer, and more successful. So if this connects with you, share with another driver and try the breathing exercises today. Links below. Have a good day, drivers.